Oops.
Good morning, everybody. This is Jonda Clemmings from Cohio, and joining me this morning is Yvette Bethel, and we're going to be presenting the 2015 Point-in-Time Count and Housing Inventory webinar for Ohio. On the screen that you see right now is actually the HUD poster that they've created for the 2015 count, and this is on the HUD website if you'd like to utilize this in your local continuum for your count. I'm going to turn this over to Yvette at this time so that she can give you a little bit of information on the logistics for today.
Good morning, everybody. The 2015 Ohio HIC and PIT count will take place on Tuesday, January 27th, 2015. We were asked by a number of you last year to hold our HIC and PIT count training earlier in the year so that you had time to institute the strategies that would be discussed in the training into place. So this year, we scheduled our training earlier, and we are lucky enough that everything is aligning with HUD's recent release of their sample documents, guidance document, and notice. Before we begin this webinar, I would like to take a couple of moments to review the technical pieces of the webinar. This call is muted due to the number of participants that we have on the line. If you would like to pose a question during the webinar, please use the questions function on the GoToWebinar control panel. We will make every attempt to answer questions during this webinar. However, if we are unable to respond during the webinar, we will send you an email after with the answers. If you have technical difficulties with the audio or video portions of this webcast, try logging off, then logging in again and using the telephone for audio. Finally, materials from today's webinar will be available on Cohio's website at www.cohio.org following today's presentation. We'll also be going to the website during the presentation today to kind of walk you through that process as well.
Great. I'm going to start off by talking about some of the point-in-time count changes and the housing inventory count changes that HUD has enacted for this year. First off, HUD has provided additional guidance about counting standards and the methodologies that they want to see in this year's point-in-time count. And a link to those various documents are going to be provided to you later in this PowerPoint, and we'll go through those with you to let you know what they are. We'll be reviewing many of the highlights from that methodology guide today, but I do want to make sure that at your local coalition level and at your local COC level, that whoever is in charge of your point-in-time count really reads through that entire document, because we'll not be reading through everything today, and it will be your responsibility to have a clear understanding of that information. So, secondly, each continuum of care is going to be required to report on the total number of youth households for those persons under age 25. And just to note here, that is a difference in the age of what we've been looking at before. There's been a lot of things that we've been looking at that have been for under age 18, but please note that many of the things this year are under age 25. We will not be required to submit data on one or multi-child households this year. There's only going to be a children's table that's going to be counted. And also, HUD is requiring that we report on the number of sheltered and unsheltered chronically homeless veterans and chronically homeless veterans and their families this year. Additionally, HUD has also aligned the gender categories to match up with the 2014 HMIS data standards. So you will need to report on the number of persons that report as transgender male to female and transgender female to male. And finally, persons that are included under the multi-race category should also be counted in at least 2 other race categories. So that might be under Asian and Caucasian, it might be African American and Caucasian, whatever those 2 races are. I'm sorry, guys, I got a little tongue-tied there.
All right. So in regards to the youth households for persons under age 25, COCs will be required to report the total number of youth households, including their race, ethnicity, and gender for parenting youth and unaccompanied youth. For parenting youth, for those who identify as parents or legal guardians of one or more child who are present with or sleeping in the same place as that youth parent, and where there is no person over the age of 24 in that household. Parenting youth is limited to persons in households where there is no adult person over the age of 24 in that household. Unaccompanied youth are persons under the age of 25 who are not presenting or sleeping in the same location as their parent or legal guardian, including single youth, youth couples, and groups of youth presenting as a household. For purposes of the PIC count, parenting youth are distinct from unaccompanied youth. Data on youth households is a subset of all household data. Youth included in the youth household table and related demographic data should still be included in all household data.
Great. There are also a couple of changes to next year's housing inventory count chart. First off, continuums of care will be required to enter the address for all projects except for those that are victim services projects. So if your project site is located at 111 East Main Street in Columbus, that's the address you're going to need to provide with your project. However, if your project uses a scattered site model, there is a way that you can indicate that it's a scattered HUD, or you can also utilize the administrative address for your organization. Please note that any references to the data standards for HMIS in this training, along with the methodology, guidelines, and additional resources that we're providing, they are all consistent with the updated HMIS Data Dictionary, the Data Standards Manual, and the Project Descriptor Data Elements Manual that were released earlier this year. And finally, for those COCs with overflow beds, they should report the total number of overflow beds that were available for occupancy on the night of the housing inventory count. And if there is no fixed number of overflow beds, then the COC can report on the number of overflow beds occupied on the night of the housing inventory count. Remember that as you start to plan and continue to plan for your local point-in-time count and housing inventory count, I just want to remind you of how important it is to work with all the various homeless subpopulations to ensure that we are obtaining as detailed a count of the homeless in our communities as possible. We really want to portray an accurate account of what homelessness looks like across all 88 counties. Each project that is reported in the housing inventory count must provide a point-in-time count number. This number should be the unduplicated number of persons served on the night of the count in the beds reported for that project. This includes all persons who enter the project on or before the date of the housing inventory count and PIT count, and who are either still in the project or exited after the date of the count. Although rapid rehousing and permanent supportive housing programs are not included in the continuum of care-wide point-in-time count of homeless persons who are sheltered and unsheltered, all rapid rehousing and permanent supportive housing programs must provide an actual point-in-time count of how many people are in their program on the housing inventory count. According to the Continuum of Care Program interim rules, COCs must plan and conduct, at least biannually, a point-in-time count of homeless persons within that geographic region. PIT counts are carried out on the night or on one night in the last 10 days of January. And HUD's point-in-time count data has become increasingly important as a measure of our local and national progress related to preventing and ending homelessness, especially with meeting the goals of Opening Doors, which is the federal strategic plan to prevent and end homelessness. Furthermore, there are several other entities that are utilizing the data from the point-in-time count outside of HUD, and we need to report an accurate reflection of those various characteristics of the persons experiencing homelessness. And just for example, this comes into play with the veterans that are homeless. The VA is actually looking at the data that they receive from the point-in-time counts to determine what the need is for additional, say, HUD VASH vouchers. Similarly, SAMHSA through HHS, or Health and Human Services, looks at the data as far as homeless youth. They also look at those data as far as for the PASS program to see where additional programs or additional funding needs to be spent.
All right, so why do we count the homeless? Information about unsheltered and sheltered homeless people is useful for obtaining current and accurate data, securing data on homeless characteristics, planning for the homeless system, and raising public awareness about the issues of homelessness. In addition to informing the national priorities and HUD funding decisions, the PIT data is an extremely important source for local program and system planning. Having reliable local data on homelessness can also play a critical role in raising public awareness of the challenges facing people who are homeless and bolstering efforts to garner additional public and private support. Furthermore, the information can be utilized to meet state HUD requirements, measure COC progress towards ending homelessness, determine if the COC is meeting its local performance thresholds, and attract new people to volunteer for homeless cause. Finally, the data allows us to understand the trends among homeless populations, adjust programs and services to meet the current need, and use resources most effectively and efficiently, and to justify requests for additional resources. So each year, HUD releases the Annual Homelessness Assessment Report, otherwise known as the AHAR. It is a report to Congress that provides the nationwide estimates of homelessness, including information about demographic characteristics of homeless persons, service use patterns, and the capacity to house persons experiencing homelessness. The report is based primarily on data from HMIS, but also utilizes HIC and PIT information. At the national level, the AHAR is utilized to determine the progress that is being made to end homelessness and help with funding decision making.
So this year, HUD actually has put out some point-in-time count standards, and this information is included in the point-in-time count methodology guide that I've mentioned this stuff a couple of times this morning. And just wanted to spend some time going over those different standards. So first off, continuums of care are responsible for planning and conducting, at least biennially, a point-in-time count of the homeless persons within their geographic area that meets HUD's requirements. Second off, the sheltered and unsheltered counts must be conducted during those last 10 days in January and represent all homeless persons who were sheltered and unsheltered on a single night during that period. Third, the final point-in-time count methodology must be approved by the Continuum of Care in accordance with the Continuum of Care's governance charter. So if your governance charter doesn't have anything in there as far as how you're going to count the homeless, make sure that from that COC level that those changes and stuff are made. Fourth, all COCs should consult and collaborate with all of the consolidated plan or CONPLAN jurisdictions in the geographic boundary of your continuum of care, including those that do not have Emergency Solutions Grant funding, to assist the jurisdiction in submitting point-in-time count data that is relevant to completing the CONPLAN. Fifth, COCs must provide point-in-time count data to the entities responsible for the CONPLAN jurisdictions associated with the Continuum of Care. The Continuum of Care must also account for and report on all sheltered homeless people residing in the continuum. Seventh, COCs must be able to verify that the sheltered people identified in the count are sheltered on the night designated for the count as defined in the homeless definition final rule. 8, COCs should use HMIS client data as the primary data source for the sheltered point-in-time counts for emergency shelters, safe havens, and transitional housing projects that are participating in HMIS. COCs must also account for and report on all unsheltered homeless people residing in the COC's geography territory. 10th, COCs may exclude geographic areas where the COC has determined that there is no unsheltered homeless people, including areas that are uninhabitable. And they give an example of you don't need to go out and count in deserts when you know people won't be living up there. 11th, COCs must be able to verify that the unsheltered homeless people identified in the count are unsheltered on the night of the count. 12th, COCs must ensure that there is an unduplicated count of homeless persons. 13, the surveys of the sheltered and unsheltered persons must be administered in a manner that protects the participants' privacy and safety, as well as the safety of the person completing the survey. So that would be possibly your volunteers or one of your enumerators. And finally, CRCs are required to ensure that people conducting the point-in-time count, including project staff and community volunteers, are appropriately trained about the count standards, data collection procedures, and protocols for privacy, security, and personal safety. So let's talk a little bit as far as some of the point-in-time count methodologies we can use. So HUD wishes to ensure that all CSCs are collecting accurate and reliable data on the total number and characteristics of all persons experiencing homelessness residing in their geographic area on a single night. HUD understands that COCs cannot count everyone, nor can they count everywhere. So they allow COCs to use either a census or a sampling approach, or a combination of those. In a census count, an attempt is made to count all persons experiencing homelessness in the continuum of care. A sampling count allows a continuum of care to sample a smaller group of homeless people that are selected from the largest homeless population or a subset. Now, I do want to caution you here that you need to talk to your COC lead person responsible for the point-in-time count. I know many continuums have decided they're only going to do the census count, and to be honest with you, HUD notes that it is preferable that the continuums of care conduct a census count whenever practicable, since it can provide the most accurate and complete information. And I do want to caution you about utilizing any kind of sample approach to ensure that you're utilizing a statistically valid and reliable sample through either a random or non-random sampling. And as noted earlier, continuums of care can also choose to do a combination of a census or sampling approach to completing their point-in-time count.
Great. The point-in-time and housing inventory count are integrally related. The sum total number of persons reported in the emergency shelter, safe havens, and transitional housing projects in the point-in-time fields of the housing inventory count must match the sum total of sheltered persons reported in the point-in-time count. Any discrepancies between the sum total number of sheltered persons counted on the housing inventory count and the number of sheltered persons counted on the point-in-time will result in a validation error requiring the COC to make corrections. Continuum of care should complete their unsheltered count on the night designated for the count, or what they call the night of the count approach. The COC can also take the 7 days following the night of the count or post-night to complete service-based counts asking where the person stayed on the night chosen for the point-in-time count. An unsheltered count may also be called a street count or night count that involves counting people who are staying in public or private places, not designated for human habitation during the period between dusk and dawn on the night designated for the point-in-time count.
So HUD has provided us with the flexibility of using one or more unsheltered count strategies to seek an accurate account of persons experiencing homelessness within your COC. A complete coverage count is where the whole COC geography is canvassed to search for unsheltered persons. The known location approach is utilized when the COC identifies locations where people are known to be unsheltered and where they are known to tend to congregate at night, such as in certain neighborhoods, possibly at tent encampments, under bridges, etc. The random sample strategy identifies all of the geographic areas within the COC where homeless persons may be staying and selects a sample of those areas to canvass. Additionally, the service-based count is usually done on the post-night counts, where various social services are provided for persons experiencing homelessness, such as soup kitchens, food pantries, day shelters, libraries, etc. And you complete an interview to determine if the person was unsheltered on the night of the count, as well as still gaining their characteristics. For the shelter count, COCs should include all individuals and families who meet the criteria in paragraph 1, 2 of the homeless definition and 24 CFR, which is the Code of Federal Registration, 91.5 of the homeless definition final rule. This includes individuals and families living in a supervised, publicly or privately operated shelter designated to provide temporary living arrangements, and this can include congregate shelters, transitional housing, and hotels and motels that are either paid for by charitable organizations or by federal, state, local governments for low-income individuals on the night designated for the count. This includes persons also residing in safe havens. So, we talked a little bit now as far as who you are supposed to count. Now let's spend a little time talking about the persons you are not supposed to count. So, persons residing in the following settings on the night of the count are prohibited from being included in that sheltered or unsheltered point-in-time count. So first, those persons that are residing in permanent supportive housing, including persons housed under the HUD-VASH program, the Veterans Affairs Supportive Housing VASH vouchers. Secondly, persons residing in the rapid rehousing demonstration projects that were funded in 2008 COC competition, and I think there's 4 of those across the state. Additionally, persons counted in any location that's not listed on the HIC. So if they're staying in projects with beds or units that are not dedicated for persons who are homeless, they are not able to be counted as homeless. We also want to make sure that we're not counting those individuals or households that are temporarily staying with friends or families, to where those people that we count as being either doubled up or couch surfing. Additionally, persons residing in housing that they own or rent, for example, other types of permanent housing, including persons that are residing in rental housing with assistance from a rapid rehousing project on the night of the count. Sixth, those persons that are residing in jails, possibly juvenile corrections facilities, foster care, if they're in a hospital or a detox center, we are not to count those individuals. And finally, persons who are receiving homelessness prevention or eviction prevention assistance should not be counted as being homeless. There are some basic logical planning that goes into preparing for your point-in-time count. First, you should identify your point-in-time count committees, their roles and responsibilities, and the committees may include a volunteer recruitment and training, public relations, marketing, logistics, just depending on what your community is interested in. There's an array of different committees you might want to choose to utilize for your point-in-time count.
All right, so in regards to the intent and scope of your PIT count activities, during your PIT planning, you should decide the intent and scope of the activities that are going to occur with the point-in-time count. Is your COC going to do just those minimum HUD requirements and collect the minimum data required? As a COC, do you want to collect additional information or characteristics on the population of people who are homeless in your COC? Do you want to utilize the point-in-time count as an opportunity to conduct some assertive outreach and engagement of persons experiencing homelessness and help them get engaged in services and programs? Some COCs have followed the 100,000 Homes campaign to complete a registry of homeless persons within the continuum of care. That includes identifying each person by name, completing a vulnerability index or similar assessment to identify needs, etc. Do you want to offer an activity such as a Project Homeless Connect or Veterans Stand Down in collaboration with your count to link persons experiencing homelessness with mainstream and community resources? And lastly, do you want to use the count to promote community awareness to homelessness and or build your volunteer base? As mentioned earlier, Ohio has designated January 27th of 2015 as Ohio's point-in-time housing inventory count date. Ohio encourages all COCs and local communities to count and decrease the risk of duplication across the state. Ohio encourages all COCs and local communities to utilize that last Tuesday of the month each year so that we have a consistent Ohio count and decrease the risk of duplication across the state. This also allows Ohio to develop a snapshot of the number of homeless persons over a 24-hour period. We understand that many of you conduct your unsheltered counts in the middle of the night or early in the morning, so it is important that we identify that date of the count. HUD created the graphic in the slide to help explain that what they mean by the day of the count. The night of the count starts at sunset on January 27th, and it ends at sunrise by January 28th.
We're going to be showing you in a little bit a coordinator's manual that we've been utilizing at Ohio for the last several years for sort of a coordinator's manual, so for the person that's locally leading up the point-in-time count and the HIC. And also in the point-in-time count methodology document, HUD also describes some of the timelines or suggested timelines that they encourage you to utilize for doing a point-in-time count. And I really encourage you to really start planning, if you haven't already, to get everything aligned for that last week in January. And as a community or a COC, you also need to determine which type of count methodologies you wish to employ as part of your count based on your local capacity. Remember to take this into consideration, what your local circumstances are, how many volunteers, what kind of capacity do you think that you'll have to be able to canvass multiple locations? How many volunteers just in general are you going to have that are going to be able to take on all the various tasks, and specific timing issues for your local count and how much area do you need to cover. Next, you need to have a plan for data quality and that big thing, deduplication of the point-in-time count so that we're not double counting people. Part of this will include utilizing some type of deduplication method to ensure that you are not double counting persons experiencing homelessness. It is also extremely important that each count has someone that is going to be dedicated to ensuring that the volunteers are trained in the homeless definition, the count purposes, the count requirements, and how to confirm someone's homeless status and that the person hasn't already been counted. As you know, these basic tenets of our counts start with those frontline volunteers who are out collecting the information. And they need to have a thorough and complete understanding of the purpose of the count and what is expected of them. It should be explained to the volunteers that if persons do not meet the homeless criteria, that they should not be reported to HUD or collected at that local, state, or continuum of care level. It is important that prior to the count, that your point-in-time count committee designate the locations that your count will take place. This includes both your sheltered and unsheltered locations. As you are determining how large of an area that you are going to canvass, taking into consideration the number of volunteer enumerators that you have and their ability to cover the locations. Additionally, make sure that you assign locations that you want your volunteer counters to cover to decrease that risk of covering overlapping areas and placing you at higher risk for having duplicative numbers.
As we've mentioned earlier, HUD has provided additional guidance this year to improve the overall quality and accuracy of the count. HUD is providing Continuum of Cares with a set of model surveys that can be used for the 2015 count. These surveys reflect the review of best practices and the input of leading survey and homeless methodology experts. Later in the PowerPoint presentation, you can find links to these surveys and accompanying instructions on the www.hudexchange.information website. Again this year, HUD is requiring COCs to collect demographic characteristics of all sheltered or unsheltered persons experiencing homelessness, including household types. HUD has designated 3 different household types: households with at least 1 adult and 1 child, households without children, and households with only children. Additionally, within those household types, you must report on the number of persons and households for each. Continuum of Cares must also report data on the gender, race, and ethnicity for each person experiencing homelessness. Please note that for anyone that is counted under multiple races, please make sure that the person is counted in at least 2 of the race categories. And I think Jonda talked a little bit about that earlier. As you most likely know, we are all working on ending veterans' homelessness. And it is very important that we enumerate homeless veterans and those in their households. This year, we are to collect data on the number of veteran households, total number of veterans, total number of persons in veteran households, and the gender, race, and ethnicity of veterans. Please note that data for the gender, race, and ethnicity of non-veterans in veteran households will only be reported under the all households population data. And beginning in 2015, COCs must also report on persons in youth households, including gender, race, and ethnicity for parenting and unaccompanied youth. And as we discussed earlier in the presentation, parenting youth, unaccompanied youth, and veterans will be a subset of the all households data.
So for this year, there's been a few changes to the subpopulation data for 2015. So starting in January, we must report on the number of chronically homeless veterans and the persons in chronically homeless veteran families. Chronic homeless veteran data is a subset of the chronic homeless subpopulation and should be included in that chronically homeless subpopulation data. Remember that when you are training volunteers to administer your surveys, that you review that responding to the disability status questions is voluntary and that they will not be refused or denied services if they choose not to respond. So you can see here on this chart that we're still looking at those persons that have severe and persistent mental illness, substance use disorders, HIV and AIDS. Domestic violence is also still being counted if you choose to do that, along with chronically homeless individuals, chronically homeless families, and persons in those families. So just a couple changes there for this year.
All right, so to talk a little bit more about youth and veterans. In the opening doors, the Federal Strategic Plan to Prevent and End Homelessness, they set the goal of ending homelessness for veterans by 2015 and for youth, and this is along with families and children, by 2020. Special strategies must be employed by COCs to address the unique data collection needs of unsheltered homeless veterans and youth, to make certain that we understand the scope of homelessness as it relates to these two populations, and to assure that we are meeting the goal in ending homelessness for them. There can be some challenges to counting homeless youth. It's important to recognize the unique situations of homeless youth in order to better find and include them in your counts. Most homeless youth do not access homeless services that are more designed to serve adults, such as food pantries and shelters. Homeless youth are transient and tend to congregate in different areas during various times of the day. Because homeless youth might not follow the same patterns as homeless adults, continuums of cares should consider including strategies for counting youth that might be different than what you would have done in the past when counting homeless adults. Also, many homeless youth would not consider themselves homeless, or more often than not would not want to be found. The reason is not because they don't want help, but for fear that they would be turned into law enforcement or even be turned over to child welfare. In many cases, these youth are in a situation where they're fleeing or attempting to flee a bad situation that could be something like abuse. When planning your counts, begin to think of ways to tailor survey questions to youth, and train volunteers and those that will be out administering surveys on techniques to capture the data on homeless youth. One thing specifically that I wanted to talk about is you don't want to ask a young person, are you homeless? Instead, you might want to consider stating questions differently and framing the question more around where they are staying or sleeping and with whom they are staying with and for how long they have been there. So if we can talk more about counting strategies, for the reasons I just described, it's vital that Continuum of Cares engage community partners and agencies that serve youth or young adults. It's also important to think about places where youth go in your communities and begin to familiarize yourselves with these spots. It's important to collaborate with local school district homeless liaisons. Schools can be important partners for your PIT counts. Local school districts should be contacted to help conduct outreach and increase awareness about the count. School liaisons have crucial insights about how best to access and communicate with homeless youth, and can be an important resource for spreading information about events and organizations associated with the COC's point-in-time counts. COCs should also collaborate with local school district homeless liaisons to help identify all homeless children who are unsheltered or staying in a shelter on the night designated for the count, and to ensure that they're included in the count. Since schools use a more expansive homeless definition than HUD's definition, for the count, it is important to confirm that only children and youth meeting the HUD definition are included in the point-in-time count results reported to HUD. Recruiting currently or formerly homeless youth is a good way to assist in your counts as well. For the unsheltered count, communities that have successful strategies for conducting counts of unsheltered youth often enlist homeless or formerly homeless teenagers and young adults to assist with their count. And before the count, these youth can assist in identifying where unaccompanied youth might be staying or congregating. They can also be available to provide input on survey design and like how to frame questions, provide assistance to outreach efforts on the night of the count, and engage homeless children and youth in the point-in-time count process. You want to also engage organizations serving homeless youth, as I spoke of earlier, identifying and engaging all stakeholders that might encounter or serve unaccompanied homeless youth ages 24 and under to participate in local point-in-time count planning meetings. Key providers include runaway and homeless youth programs, youth street outreach programs, faith-based organizations and youth groups, youth empowerment programs, and LGBT service providers or centers, libraries, and recreation centers. Also, identifying locations where homeless youth congregate is crucial. Get input from youth and youth providers to identify locations or hotspots, which might include abandoned buildings, skate parks, bus stations, coffee shops, malls, LGBTQ-friendly gathering spots, any place in your community that youth might congregate. And this could also be encampments inside and or outside of some of those urban areas. Some more strategies that I wanted to touch on are, you can think about holding magnet events, and this would be to develop special events located at easily accessible and non-threatening locations that include activities, food, or other appropriate incentives that might draw in youth who do not typically use shelters and services and are difficult to locate on the streets. Also utilizing social media to raise awareness and outreach to young people. Data from studies have indicated that even youth living on the streets use social media. Social media can be used to spread the word about the count, including information about location and incentives, which could lead to a larger number of youth participating in the count. Also identifying lead homeless youth point-in-time count coordinator to facilitate data collection, engage other youth providers, and coordinate collection of data from locations where homeless youth congregate. And then lastly, providing services, food, and incentives to youth being counted. This can help draw youth in as well. The incentive could be advertised as part of the general mobilization effort to attract youth to participate in the count. Examples of incentives include two-way public transportation or bus passes or tickets, credit cards for $10, backpacks filled with hygiene items, food, or information about your community, $5 restaurant cards, movies, games, and just providing a warm, dry place for the young adults or youth to spend time with friends for the night. So continuum of cares will need to be creative and develop strategies to ensure that unsheltered counts cover or systematically sample locations where unaccompanied homeless youth congregate. COC's efforts to overcome the challenges with counting youth can result in promising practices that will improve the accuracy of homeless youth data locally and nationally in future counts. I understand that youth can be difficult to find and count on the night of January designated for the count. So COCs and communities that desire a broader understanding of homeless youth in their area might consider other ways to supplement their PIT count data. Some of the promising practices communities have used to gain a better understanding of their homeless youth population include more frequent PIT counts, conducting counts focused on youth that occur over longer periods than the COC's normal counting period, and implementing survey questions that identify homeless youth that meet other non-HUD definitions of homelessness for community planning purposes. Information on creative strategies and implementation of many of the recommendations improving how COCs count unsheltered youth can be found in the Urban Institute's report, Counting Homeless Youth, Promising Practices from Youth Count Initiative. Youth Count was an initiative that included 9 COCs from across the country that focused on improving counts of unaccompanied homeless youth for the 2013 HUD PIT count. And actually, there was a runaway and homeless youth project in the state that was a part of that Youth Count initiative. And I've included the link here to access that report if you're interested. So I wanted to go into talking about counting homeless veterans and strategies for doing so. So similar to youth, counting homeless veterans can be somewhat of a challenge. Locating, counting, and interviewing homeless veterans that are unsheltered can be very tough. But utilizing effective strategies and engaging other service providers can make targeting and counting veterans easier. A couple key methods I wanted to mention that can help COCs become more effective is to know how to engage veterans when asking survey questions and tailor questions to determine status. You may want to break down the veteran's status question by asking the person if he or she ever served full-time in the military, and you can also list out the different military branches, like if you want to be more specific and say Army, Navy, etc. If the person answers yes to that question, then he or she is considered a veteran. However, if the person answers no, you might want to go a bit further and ask if the person was ever called up to active duty from the reserves or from the National Guard. And if they had done that, then they are also considered a veteran. It is critical that local Veteran Affairs staff are engaged and participate in both the sheltered and unsheltered point-in-time count. However, COCs should be mindful that some veterans might not be eligible for VA services, so it is important that other partners, in addition to the VA or Veterans Affairs, participate in identifying and locating homeless veterans. Ultimately, combining COC and VA knowledge and resources will result in a more thorough and accurate count. All right, so some things that you can think about are to engage your local VA medical center or your VA vet centers or VA department staff that have experience in screening and interviewing veterans to determine eligibility for VA homeless services, as well as those who provide services to homeless veterans or work on homeless issues to help plan and implement the count. And so if you contact these people and they have the knowledge and experience, they can help with locating unsheltered vets. And VA medical centers and VA vet centers can have homeless coordinators and outreach workers who regularly interact with veterans, including homeless veterans. These staff are knowledgeable about the locations where unsheltered homeless veterans live, sleep, and congregate, and can identify these places that must be included in the unsheltered count. They can also be helpful in providing guidance on count and survey instruments. So VA staff can offer technical guidance to improve data accuracy. And they can also help with assisting during the count. Veteran homeless coordinators and outreach workers can form special teams to canvass encampments and other remote areas that might not have been included in previous counts. Their relationships with the veterans could also help homeless veterans feel more comfortable in providing information during the count. So in looking at strategies, reach out to your local veteran service organizations, and that could be the American Legion or Disabled American Veterans organizations for their cooperation with the count, especially in rural areas where there might not be many homeless service providers. Veteran service organizations provide assistance to homeless veterans and their families. Some veteran service organizations have funds that are set aside to assist these families with motel vouchers and utility payments as well. You also might want to think about recruiting homeless or formerly homeless veterans to be enumerators for the unsheltered count. Like youth, homeless veterans can be an indispensable resource while planning and conducting a PIT count. Before the count, they can assist in identifying locations where unsheltered homeless veterans might be living. They can also participate in the count itself, as they might be able to gain the trust of other homeless veterans more easily than other staff or volunteers, and they might have more success in completing those surveys with those homeless veterans.
As we mentioned earlier, HUD is once again asking us to compile data on chronically homeless. And in collecting that data on the chronically homeless, that can also be difficult, just as what Yvette was mentioning with trying to count homeless youth, or veterans. And I'd just like to suggest that instead of asking a person about whether or not she is chronically homeless, that you ask a number of the questions that get to that definition of homelessness. Yeah, that's a great new word I just created there. Chronically homeless, such as the number of times that the person has been homeless, the length of time that they've been homeless, where they've been staying, with whom they've been staying, just so that you can try to get to all those various components that go into defining chronically homelessness. Similarly, it's also difficult to determine if someone has a disability or a disabling condition. Initially, you need to determine if the person has one of the conditions listed on the slide, and I think we got a little pause here with waiting for the slide to come up. I apologize for that. But you need to look at the various disabling conditions as far as substance abuse, which might include alcohol and drugs, mental health issues, developmental disabilities, chronic physical illnesses, HIV and AIDS, other disabilities. And besides knowing if they have that actual condition, we want to find out if that condition has limited the person's ability to live independently, and could the condition be improved through the provision of more suitable housing conditions. And that gets us a little closer to that disability status. I know Yvette just spent some time talking about partnering agencies, like with your veterans and the youth, but we also wanted to talk about just overall some really good partnerships with various organizations and groups that can be helpful for your count. And I think if you've ever been involved with a count, you know that securing the volunteers is just such a vital component of your count. That the volunteers should be involved throughout all stages of the count, from that initial planning to the data analysis. There are several potential organizations and persons in your community that would be willing to support this effort, and you should start now to reach out to them for assistance in planning and executing the count. Some of those partners are included on this page, such as persons with lived experience, local homeless providers and other social service agencies, your government officials, your local colleges and universities. Many times you might find a professor that wants to take this on as a class project, and besides doing enumerating, they might be willing to help you with the data analysis or cleaning of the data, something like that. Also, make sure that you're inviting that comp plan, since they're supposed to be involved with getting the homeless information and data and providing it within the comp plan. It's really good to have them frontline so they understand the plight of homelessness. Faith-based organizations, civic groups, those are all great groups and stuff to have lined up. I did want to just sort of pause here for a moment and talk about the utilization of law enforcement. I really think that law enforcement can be another vital partner with you as far as with the count and helping you find out known locations where people might be when they're doing their drives around the community. They might find things or find where people are staying. They'll also might have received complaints from neighbors or people in the community about people living off the land. Just really think about how you can utilize law enforcement in that way to collect that information. Similarly, and I apologize, I forgot to actually put this on the slide, but it's also a really good idea to involve your fire departments, because there might have been fires or things such as that in houses, apartments, where people were staying in abandoned houses, that they can point you to say, this is some good places for you to search. And I think anytime that we can get our foundations, the civic groups, our business communities more aware of the plight of homelessness, and also let them have a better appreciation for all the services and programs that you're providing in the community, really can give them a different view on homelessness and hopefully help you to get buy-in on other projects or volunteer commitments, things such as that you need. So besides securing that volunteer support from your community, it's also essential that you gain political support, active participation, and funding support for your project. You can reach out to various entities and invite them to participate in the count, provide publicity, financial support, help encourage others or influence others to participate, provide incentives for those being interviewed to participate in the surveys, or even providing assistance with the count methodology or data collection. This is all really good ways of just figuring out who you can turn to. I've heard of a number of hotels across the state that have been willing to give out hygiene items, you know, the extra bars of soap, combs, lotions, shampoos, you know, that they have in the rooms. That's a good way to come across those. Looking towards your faith-based organizations to see would they be willing to do a blanket drive for people, look at some of that cold weather gear that people might need, whether it's propane or propane heaters, tents, blankets, sleeping bags. If you can get groups that are willing to do some kind of donation and stuff to you, that really can help with providing those incentives and making sure that you're not only just counting the person, but you're giving them something for their time and helping them along the ways while they're dealing with homelessness. And I know I mentioned in the previous slide that law enforcement can be a valuable supporter of your count with providing that information. But I also want to say that you need to be aware that law enforcement support on the day or the night of the count could possibly deter participation. Families may be concerned about being turned into children's services, or youth might worry that they'll be turned in to children's services or parole, probation. People that are on warrants might be concerned and stuff that they'll end up going to jail. So I really encourage you before the count, even starting now, to have conversations with your local police chiefs, your sheriff's offices, probation parole officers about law enforcement's involvement in the count, and see if you can't be able to come to an understanding about how these kinds of things are handled. So, for instance, if they do come across somebody that has a warrant out, that they're not going to take them into jail, or they'll not take them into jail as long as the person is not being physically violent at that time. Similarly, you really need to have some good conversations with children's services. Many communities within children's services, if a household has children in it, is found to be homeless, the children's services could charge them with basically abuse and neglect. And it would be good to have an understanding with your children's services starting at this point to say, okay, if we do come across a household that has children, can we not have them charged if we are able to move them into a shelter for that night or move them into a hotel and motel that's paid either through some nonprofit funds, faith-based funds, government funds, so that they're not actually homeless. You'd still be counting them since they'd be staying in a hotel motel that's funded by people but themselves, but they could not have to worry about being charged having their children and stuff taken care of them. So just keep those kind of things in mind. I really think that it's also a good idea that you let a lot of your community big stakeholders know about your count. So send an email, send a fax to the chief of police in all the various areas of your community, to the sheriff's department, any places like that, to let them know that you would be counting so they're not worried about seeing all these people stalking around neighborhoods and things such as that. Additionally, we often hear from COCs and some of our local communities that there are just certain key providers or agencies in the community that are not interested or willing to participate in the count. And I would encourage you to schedule a meeting with them now in person to discuss the count and the value of their participation. It's important to discuss the vital nature of the information and how their participation will paint a better picture of homelessness in your community. Ask them about their concerns about participation and really listen to them, and try to figure out if you can alleviate those concerns by integrating some interventions into place to address those concerns. If you're unable to make changes to a specific count process, procedure, something like that, explain why you can't do it. For instance, if they come back and tell you, well, you know, that last week in January is just a silly time to be doing the count. You know that we actually have more people and stuff that are homeless and stuff in June that we see around town. Well, you can come back and say, you know, that's a HUD requirement, and we really can't change that. HUD requires that we do our count that last 10 days of January, thinking that due to that colder weather, more people will be going into the shelter at that time, that at the end of the month they've already utilized any money that they might get as far as income or SSI or SSDI, and that'll be gone, so they'll be seeking shelter that way. It's before people start getting their tax money in, so they're really low on funds, but just really trying to address with them what those concerns are and what are some of the reasons why you have to stay within a certain requirement policy process. So additionally, be ready to provide volunteer assistance and volunteer resources to that organization if they've been reelected in the past. Possibly it's due to the fact that they just do not have enough volunteers or assistants and stuff to be able to take on a count like that. They might not collect all of the information that either state or federally funded programs do. So say, you know, we can have volunteers and stuff come and do the survey interviews or partner with you to do those interviews. I also know that there's been a couple of communities where they've run into this type of reluctance that, especially in like some of those shelters where they say, you know, you have to leave by 8 o'clock in the morning or you can't come until 6 o'clock or 7 o'clock at night. I know some folks that have basically either stood across the street or stood down the street and at least enumerated people as far as counting them, seeing how many people are coming in and out of those type of shelters, so they could at least get that bare bones kind of information.
All right, so let's talk about volunteers. I mentioned earlier it is important to have volunteer support from the beginning of your planning through the data analysis. Volunteers can help with the actual enumerating or by actually counting the homeless. They can help with setup and shutdown of meetup locations. They can help distribute materials, man the count's emergency phone number, or help with transportation. And then past enumerators can share their experience at the volunteer training. Others can assist with ensuring that enumerator surveys are clear and correctly completed, perform data checks, make sure there's no deduplication of persons, verify count numbers from HMIS with providers, enter data into HMIS. While others can help secure donations to be utilized as incentives for participants to participate in the count and or help meet their daily needs. Others can solicit donations to support the count, such as securing food and hot beverages for the enumerators. Others might have skills in raising the awareness of the point-in-time count by handling the publicity and media relations of the count. There are a number of roles that volunteers can play to help you with your point-in-time counts. The most important thing to remember here is that training of the volunteer is the utmost importance. Volunteers have to know your expectations of them and what their roles and responsibilities are and will be. So make sure that you provide plenty of training for all of your volunteers, no matter which role they are assisting with. The point-in-time count methodology includes many of the topics that you should provide in your volunteer training, such as the purpose of the count, who to count, where to count, maintaining safety, utilization of survey documentation, and what to wear and what to bring with them. So the next several slides will provide you with the links to the various point-in-time count guidance materials, along with the sample forms that I had mentioned a few slides back. And I think the majority of these will be on the HUDexchange.info website.
Yvette, I was wondering if you could do me a favor and pull up our actual coordinator's manual at this time for me. That way people can see the table of contents. Thank you, dear. As I mentioned this stuff earlier, this is a document that we've been working on the last several years to be able to provide, for lack of a better term, almost like a point-in-time count in a box for you. That it walks through all those areas as far as like changes in the count, things that you need to do differently this year compared to past years. It talks about those purpose issues, why we're doing certain things in the count. It gives you an introduction to some of the information that we've been talking about in today's training as far as why are we wanting to count this information, who utilizes that information. Additionally, it goes into that homeless definition. So who should we actually be counting? Who shouldn't we be counting? It talks about the various programs that should be included in the point-in-time count. There's definitions in there, and this is all updated with the newest standards so that you have everything that's aligning with HARTH in there. It talks about that whole issue of what the data of the count looks like. We've got more information in there as far as timelines, when things should be planned, gives you some ideas as far as who all should be involved in the count, what a training should look like for your volunteers, if they're doing an unsheltered count, what are some of the specific things that we should be thinking about. So as a coordinator, what kind of information should you be sharing with your volunteers? What kind of, well, even down to what kind of things and stuff should they bring with them themselves on the night of the count? Yes, make sure that you've got pens with you. Make sure that you're dressing in layers. Wear boots. Bring a clipboard. Have a flashlight with you. Just any of those kind of things that we think would be real helpful in planning for your count. We've tried to make this as an inclusive document that we could. So in addition, it also talks about who some of those community providers should be that you're working with. And it also gives us some information around sort of the roles and responsibilities. I got asked here a couple of years ago, can you give sort of some of the job descriptions as far as the vital people that are participating in the count and what those would look like? So we gave you some information about what various chairs could be looking at for donations, volunteers, people that are actually the enumerators. I think I mentioned earlier as far as timelines, okay? What should you be doing 6 months out? What should you be doing 3 months out, 1 week out? How can you improve that quality of the data and stuff that you have in there? Additionally, towards the end of the document, we also included some information about how to contact some of the key veterans outreach folks. So the people that are actually working or in those, I don't know what I want to say, like middle management type positions and stuff with the VA that are doing the HUD-VASH programs. So their names are there, their phone numbers are there so that you can contact them. We also just sort of summed up on the last page, just giving you information as far as our staff contact information at Cohio. And if you're looking at basic count information, or if you're coming from one of the 8 communities that are entitlement, you can reach out to Yvette and myself for that information. If you're coming from one of the Balance of State communities, so the 80 most rural counties in Ohio, you'll be talking with Erica and Christina about more specific Balance of State information. I know Christina sent out an email, I hope I'm not lying to you, it was either last Thursday or Friday, I think, talking about a couple of additional trainings that they're going to be having for Balance of State programs this year. Given some of the intense, I don't want to say scrutinization, but just the more concern that there is with a point-in-time count and really getting accurate counts, we really need to provide some additional guidance as to what that's going to look like for the Balance of State. So there's going to be some specific forms that they're going to be reviewing with you, some specific processes, procedures. So really turn in for those webinars if you're part of the Balance of State to be able to learn more about that. Yvette, if you wouldn't mind also at this time pulling up our website, if you could.
All righty.
Thank you, dear. For those of you that are not familiar with our website address is www.cohio.org. And if you click on the Information and Resource tab and go down to the Training Materials, this will take you to the various training materials that we have provided as Cohio. And these first few things that are listed at the top are actually like anchored into them into the body of the document. So if you click on Point in Time Count, it'll take you directly to the point in time count information that we've collected for this year's count. So the PowerPoint that Yvette and I are working on, that you've been seeing today, that's on there if you want a copy of it. So you get a copy of the PDF like what we sent out to folks. We've got a copy of that coordinator's manual, and especially so that you can be able to make it unique and make it specific to your community. We left that as a Word document so you can go in and make changes if you want. And we've also provided to you a link to the various survey tools that HUD has created for this year's count. The real hope is, and even if you didn't mind, go ahead and clicking on that 2015, yes. Click there for me, thank you. This takes you to the actual HUD Exchange website, and as you can see here under the resource links, they've provided a number of sample or model surveys along with instructions and how those are supposed to be utilized. And instead of us, as far as Ohio, creating or updating enumerator surveys and stuff this year, we're just referring people to these. I do believe that Christina and Erica is going to have some specific stuff for you for the balance of state for those of you from the 80 most rural communities, but for everyone else, this just gives you some ideas of what HUD's created this year. I guess, and I don't think that we've mentioned this so far, but one of the issues that HUD has stated in a couple of their guidance documents or in their notice is they really hope that providing this additional guidance this year, that it will actually lead to us having a lower point-in-time count, that since they're providing more guidance on really who we should count, where we should count, how things need to look, how much sort of due diligence you need to do to make sure a person is actually chronically homeless. They're hoping to see a dip in the number of homeless in the 2015 count. So thanks, Yvette, for pulling this up for me. If you don't mind going back into the PowerPoint, and I think I'm going to bring up a couple of questions before we actually move on to the HIC. So one of the first questions that we had come in was explaining a little bit more about the night of the count and utilizing those 7 post nights to collect additional information. And that's actually on slide 22, which ought to be on about, or would that be about page 5 or 6 in your PDF. And on this slide, Yvette was sharing that, you know, we know what the point-in-time count night is and when we're supposed to count as part of that night. But additionally, HUD says that for the next 7 days, you can go to like service-based organizations, agencies, and collect information from them to see if the person was homeless on the night of the count, to be able to hopefully get a real firmer number on unsheltered people. So in case somebody was living in a tent encampment that you didn't know existed, knowing that you didn't have the opportunity to count them at that place, then you can say, go to your local soup kitchens, to the places and stuff that offer food from like the food pantries, drop-in centers, and basically ask those individuals, were you homeless on the night of January 27th? And if so, you can count them in your point-in-time count. So hopefully that helps there. The next question came in, and I really like and stuff how this was phrased, because it talks about just the utilization of volunteers to be able to do these kind of counts is extremely important, and especially given that so many of us that are actually doing the work of being a homeless service provider and having to wear so many hats and do so many different tasks, that it's really difficult for us to manage the counts and stuff on our own. And part of this came around, the question was, are there any additional opportunities for some funding or support for additional staff, or to pay overtime or give some kind of stipend to the volunteers for their assistance? And I cannot recall anybody in Ohio that's really doing anything innovative here. I know that there's a couple of communities that do provide stipends to persons of lived experience, so those persons who have experienced homelessness in the past, and help them, pay them a stipend to help with the count, help them figure out known locations. And my understanding of like those circumstances or others that I know in communities or CSUs that have done this kind of thing is that's where they turn to some of their local foundations or even businesses for some financial assistance to help with those kind of payments or funding. Just had sort of a clarifying question also around permanent supportive housing and the people that are in permanent supportive housing and whether or not they should be counted for the point-in-time count or not. And I know part of this is a little confusing because we are not NOT. We are not counting people that are living in permanent housing or permanent supportive housing as part of our actual point-in-time count number. So that actual PIT number, which gets submitted to HUD for the number of people that are homeless in our community. But as part of the housing inventory count, we are collecting the number of people that are in permanent supportive housing so that we can see sort of that utilization of the beds and know how many people are being served by permanent supportive housing on that night of the count. So yes, we are taking that number and it's being utilized in the HIC, but not in the PIT. And I think that's all the questions we had so far. So the next little bit, we're going to spend some time talking about the housing inventory count and just sort of really going into that and some differences in that this year and just things, a couple of things, not so much changes, but there's a little bit of a reordering of some of the elements that we got to collect this year. So the housing inventory count is a point-in-time count inventory of the projects within a continuum of care that provides beds or units that are dedicated to serving homeless persons. And it should reflect the number of beds and units available on the night of the count that are dedicated to serving persons who are homeless and for permanent housing projects, which might be your rapid rehousing or your permanent supportive housing, counting those people that were homeless at entry. The number of persons that are recorded on your housing inventory count that are located in either an emergency shelter, transitional housing, or a safe haven should equal your sheltered point-in-time count. And I think we mentioned this earlier, but just to reiterate it, if you put information into HDX, which is where we have to submit our PIT and HIC information, it'll actually throw up a red flag to us and say that the numbers and stuff are not corresponding. So we really need to make sure that those numbers are matching up there. So next we're going to talk a little bit as far as those beds and units and all that kind of good stuff. So beds and units that are included in the housing inventory count are considered part of the continuum of care's homeless assistance system. So beds and units in the HIC must be dedicated to serving homeless persons, or as I just mentioned, those in permanent housing that were serving people that were homeless at entry. And for the purpose of the HIC, a project with dedicated beds and units is one where the primary intent of the project is to serve homeless persons or families experiencing homelessness. Second, that the project verifies homeless status as part of its initial eligibility determination. And third, that the actual project clients are predominantly homeless, or once again, for permanent housing, that they were homeless at entry. So now let's spend some time going through the various programs that should be included as part of the housing inventory count and those project types, including emergency shelters, transitional housing, safe havens, permanent housing, rapid rehousing, other permanent housing, and rapid rehousing demonstration projects. So, Yvette, I'm going to turn it over to you to review those.
All right, thanks, Shonda. Okay, so we want to note that for all U.S. Department of Veterans Affairs funded projects and the HUD Veterans Affairs Supportive Housing Program, project names must include VA prefixes in parentheses as shown in this slide. Now, this is even if the project only receives a portion of its funding from the VA or HUD-VASH. And the next couple slides I'm going to go through here. Here's some more Veterans Affairs programs. Now, this is the HUD-funded programs. Next couple of slides. Permanent supportive housing, rapid rehousing, safe havens there. All right, and here are the Department of Health and Human Services specific funded projects. And these are your runaway and homeless youth projects. And then other funded programs, such as emergency shelters, transitional housing, hotel, motel vouchers for homeless persons. And then projects that do transitional for homeless youth. All right.
Sorry guys, I lost my phone connection and had to call back in, so I'm a little stunned there for a minute. So let's talk about some of the stuff that HMIS can actually help you generate for your housing inventory count. And as we mentioned earlier, HUD really encourages continuums to utilize their HMIS data as a starting point, not only for your point-in-time counts that are sheltered, but also to generate your housing inventory counts. So the continuum of care must collect and enter project descriptor data for all of the COC projects that are participating in the COC's HMIS, regardless of whether or not the COC project participates in HMIS. So you can find information on the project descriptors in the 2014 HMIS data standards, and make sure that you're utilizing those new data standards as you're collecting information and stuff for the HIC. So this is going to be sort of a little confusing here for this slide. So let me first explain. This slide information was included in the HIC and PIT notice that HUD had released earlier about what information was not going to be available in HMIS. And it's talking about sort of the rapid rehousing demo projects are counted sort of differently, other PH projects funded. But for those of you that utilize Bowman Service Points, which is the balance of state and 6 out of the 8 entitlement communities, the majority of this information is actually included in Service Point. So the only piece of this that's not going to be included in Bowman's new layout with the updated standards is the households that have only children in them. All the rest of these information and stuff is actually going to be included in HMIS, so you can pull that data out of Service Point. But for those of you that are in Cincinnati and the Akron area, since you have your own HMIS vendors or HMIS products, you'll need to see if this information is included or not. And if it's not included, make sure that you're still collecting that information so that it can go into the HIC. So now we're going to go ahead and look at the organization name. And this is one of the questions that we have to enter for the HIC. And just sort of as it sounds, the organization name is the name of the organization providing the shelter or housing to homeless persons. Now, if you are a COC funded or ODSA funded organization, make sure that you're utilizing your true business name, the name and stuff that's on your contract with them, so that there's the ability to match up those programs. I know we have some people that have an organization name that'll say John Bush Shelter, but the actual organization is John D. Clemmings Limited Liability Corporation Homeless Programs. We need to make sure that the actual organization name, and similarly when we talk about the program names, that they actually line up. So on that note, we'll talk some about that program identifier, which is the unique program name that is distinct for each one of the COC projects. So only projects that have beds available for occupancy or under development on the night of the count should be included on the HIC. And remember, for those programs that are funded through the Veterans Administration, you do have to utilize the VA prefixes for all those projects, even if they're just partially funded by the VA. So there's various project types that we have to report on, and those include emergency shelter, transitional housing, rapid rehousing, safe havens, permanent supportive housing, other permanent housing with services that do not require a disability at entry, and permanent housing that provides housing only as identified in the 2014 HMIS data standards. And then there's also the Rapid Rehousing Demonstration Project that was funded out of the 2008 COC competition.
All right, so let's talk about McKinney-Vento funded programs. Any project receiving any type of HUD McKinney-Vento funding should be marked as yes. HUD McKinney-Vento programs includes those programs funded under the Emergency Solutions Grant and Continuum of Care programs. Additionally, it includes projects that are still under their original grant contract that were funded as Shelter Plus Care, Section 8 mod rehab, single room occupancies, and supportive housing programs. Geocodes. The geocode associated with the geographic location of the principal project service site. Geocodes must be updated annually. Scattered site housing projects should record the geocode where the majority of the beds are located or where most beds are located as of the inventory update. A list of the geocodes can be found at the link that you can see on this slide. All right, as we mentioned earlier, this year HUD is requiring that the address of a project is required that the address of a project and includes a street address, city, state, and zip code. Scattered site housing projects will not have to enter an address, but will have to indicate to HUD that they are a scattered site project, or they can use their administrative offices. Victim service providers are exempt from having to provide this information regarding address. target population. A population is considered a target population if the project is intended to serve at least 75% of that population. Projects are limited to one target population. Projects that do not have a target or a specific population may leave this data field blank. So there are 11 target populations, A's, which include those listed on this slide. So we're talking single males, single females, single males and females, couples only, no children, and households with children. And also on this slide, as you may notice, HUD has changed the descriptors for youth from unaccompanied male, female or male, and females to youth male, females and male, and female. Additionally, HUD changed the ages for youth descriptors to 25 years old versus the 18-year-old we utilized in the past. And similar to the target population A population is considered a target population if the project is designed to serve that population if at least 75% of the clients served by the project for the target group descriptor. A project is prohibited from having more than one target population B.
So we're going to take a look now at the various inventory types. And I'm going to call attention to some specific dates because that makes a difference on whether or not you're counting it as current, new, or under development. So beds and units that are available for occupancy on or before January 31st of the year prior to the count. For example, for 2015, those will be beds that are available for occupancy on or before January 31st of 2014. New inventory beds and units that will be are those that will be available for occupancy between February 1st and January 31st of the year of the count. So for 2015, that will be between February 1st, 2014 and January 31st, 2015. Inventory that's designated as new should represent an increase in capacity for the project from the previous year. In order to appropriately designate inventory type, the COC must compare the number of beds available at the time of the HIC in the count year with the number of beds that were previously available at the time of last year's HIC. Finally, for those beds that are under development, we're looking at beds and units that were fully funded but not available for occupancy as of January 31st of the year of the count. So that's going to be January 31st of 2015. For inventory identified as under development, continuums of care must also identify whether the bed or the unit inventory is expected to be available for occupancy by January 31st of 2016. If the occupancy is expected anytime after that January 31st of 2016, your project should not be included on the 2015 housing inventory. Now, there are three different household types that we're going to be recording information on this year. The first type is households without children, and those are beds and units that are intended for households with adults only. This includes households composed of unaccompanied adults and multiple adults. The second type is households with at least one adult and one child. And those are beds and units that are intended for households with at least one adult and one child. And finally, the third type is households with only children, which have beds and units intended for households composed exclusively of persons under the age of 18, including one-child households, multiple child households, or other households configured that are composed of only children under the age of 18. So what happens when you have multiple household types as part of your program? For those projects, we need to try to get a precise number of beds that are not designated exclusively for a particular type of household. The number of beds may be distributed among the household types served by the project using one of the following three methodologies that HUD has approved. So the first one is to divide the beds based on how the beds were used on the night of the count for the point-in-time count in the housing inventory count. If the facility is not at full capacity on that night, then you can extrapolate from the distribution based on a prorated number served on that night. So if you have so many beds that are just for adults and so many beds for households with children, or households with at least one adult and one child, and say you have 10 beds just for adults, but you have 30 beds for households with at least one adult and one child. It's possible that those beds are fixed and they can only be utilized for one of the household types we mentioned, or they might be variable. So another way that you can address how you want to distribute that is to divide the beds based on an average utilization over the year, or for those projects that do have a fixed number of units but not a fixed number of beds, you can use a multiplier factor to estimate the number of beds. And HUD has given us sort of the example that a unit has an average size of 3. So if you'd have 30 units times the average of 3 people within a unit, you would have 90 beds for households with at least one adult and one child. Excuse me, everybody. For those that are serving emergency shelters, there's some additional bed types that we need to discuss. And those come down to whether or not it's a facility-based, a voucher-based, or other type of emergency shelter. And a facility-based shelter includes beds, cots, mats that are located in a residential homeless assistance facility that's dedicated for use by persons who are experiencing homelessness. Now, a voucher are beds that are located in a hotel or motel and has been made available through funding from a homeless assistance project, through some kind of voucher. It might be a faith-based organization paying for it. It might be a government entity paying for a hotel-motel voucher. And finally, the other category are for those kind of beds that are located in facilities that were not initially designated just to serve homeless. So I'm thinking of like some of the interfaith programs that we have that might move from church to church each week. And since the church isn't initially dedicated for use by persons with homeless, they would fall under this other type. So There are also 3 types of bed and unit availabilities that we need to take into consideration for emergency shelters. So the easiest one are those year-round beds. So the beds that are available every day of the year. The second one is for seasonal beds. Well, excuse me, let me back up on the year-round beds. That also includes for your other program types as well. It's just for emergency shelters, or we're going to talk about the seasonal and the overflow beds. So seasonal beds are those that open during a specific time, ends at a specific time, and goes by just sort of the season. And with Ohio being more of a cold weather state, this would be shelters that open, say, the beginning of December but close the end of March. There's additionally overflow beds, which can be made available in some shelters on a temporary basis, depending on the demand for shelters. So if you have a shelter that has 20 beds, but you also have 5 mats that you can utilize for people if there's more people that come to the shelter than those 20, you can utilize those overflow beds that were occupied on the night of the count. The total number of your beds available for occupancy on the night of the housing inventory count gives you that bed inventory. So for all the relevant project types other than rapid rehousing, continuums of care must include all of the dedicated homeless beds and units available for homeless persons on the date of the hit, whether the beds are new, current, or under development, regardless whether or not the project participants are included in HMIS, that they receive HUD funding, or regardless of whether or not the bed was occupied. For shelter projects, COCs must identify the number of beds that are available year-round, on a seasonal basis, or on an overflow basis. For rapid rehousing projects, you're going to look at it on any given night of a rapid rehousing project will have different number of people residing in it. So you want to look, in this case, at the number of beds that were actually being utilized for rapid rehousing on the night of the count. I hope that makes sense and stuff to folks. So for rapid rehousing, you're only including those that were in rapid rehousing that night. You got?
All right, I'm going to talk about veterans bed inventory. So for supportive services for veterans families or SSVF projects, they may offer offer both homeless prevention and rapid rehousing assistance, and may intermingle participants in the same project in HMIS. Continuum of cares must ensure that they are only counting those participants whose housing status at program entry was Category 1 homeless. For runaway and homeless youth, COCs must exclude beds that are dedicated for persons who are wards of the state, including children who are in foster care or who are otherwise under government custody or supervision. If beds are not specifically dedicated, then the COC must prorate beds based on use on the night of the count or prorate based on average utilization. And for chronic homeless bed inventory, the chronic homeless bed inventory is the number of permanent supportive housing beds that are dedicated to house to house chronically homeless persons. A dedicated bed is a bed that must be filled by a chronically homeless participant unless there are no chronically homeless persons located within the geographic area. The number of beds for chronically homeless persons is a subset of the total permanent supportive housing bed inventory for a given project and must be equal to or less than the total bed inventory. The number of beds that are dedicated to house homeless veterans and their families. So a dedicated bed is a bed that must be filled by homeless veterans and their families who qualify for the project unless there are no homeless veterans and their families located within the geographic area who qualify. The number of beds for veterans is a subset of the total bed inventory for a given project and must be equal to or less than the total bed inventory. For youth bed inventory, the youth bed inventory is the number of beds that are dedicated to house homeless youth. A dedicated bed is a bed that must be filled by a homeless youth unless there are no homeless youth located within that geographic area. And additionally, COCs will need to identify if the beds are dedicated to serve only children under 18, only persons 18 to 24, or persons up to 24 years of age.
Yvette, before I go on to the next slide, okay, I was going to say the slides are taking a little while to move there. So for talking about unit inventory, the number of units available for occupancy on the night of the inventory count. Projects that do not have a fixed number of units may record the bed inventory, the number of residential facilities operated by the program, or the number of rooms used for overnight accommodation. CFC, the next piece is around the VASH vouchers specifically. So those that are served by the Veterans Administrative Supportive Housing VASH vouchers. And in this case, COCs must count the total number of VASH vouchers available for use on the night of the Hick and Pit count, regardless of whether or not the voucher is presently being used. When a VASH project operates in multiple COCs, each COC should have project descriptor data pertaining to that project in their HMIS. Beds should be apportioned according to which COC the housing units assisted by the voucher are physically located. So I know, like down in Cincinnati, that Hamilton County has gotten some VASH vouchers, but part of those are designated to be utilized in Butler County. So that would be one of those situations where we have beds in multiple COCs. We also need to record information around the HMIS participating beds. And here we're looking at the number of beds that are identified as year-round, seasonal, and overflow beds that are participating in HMIS, so that there's actual HMIS data being inputted on those beds on a regular basis. Now, for those of you that have projects that are operating in more than one COC, and this is besides just the VASH program we were talking about, when you have that sort of more than one COC, we want to make sure that you're apportioning the beds between the COCs based on the physical locations of the date of the HIC. So, for instance, if Franklin County was providing assistance for not only Franklin County, but they were also serving Franklin, Licking, and Fairfield. The beds in Fairfield County and Licking County will be counted as part of the balance of state. The beds that are in Franklin County will be counted as part of Franklin's and Columbus's continuum of care. Each project also needs to enumerate the number of people that they served the night of the PIT count and include that number on the HIC. So this is where we're getting into that difference between the PIT and the HIC count numbers and what goes. So permanent supportive housing projects are going to include their PIT count number on the housing inventory count, but it doesn't get included as part of the point-in-time count number that we utilize either for state, federal, or even hopefully your local level.
All right, I'm going to now talk about calculating unmet need. To calculate your COC's unmet need for emergency shelter, transitional housing, safe haven, rapid rehousing, or permanent supportive housing beds, you should take the number of unsheltered homeless persons or households needing that type of program. For instance, emergency shelters in this example, and add it to the number of persons or households currently in emergency. From that number, you will want to subtract the total number of emergency beds available plus the number of emergency shelter beds under development. The number that you are left with is and should be your unmet need. When determining the need for permanent supportive housing beds, you should also need to take into consideration the number of vacant permanent supportive housing beds in your housing inventory and subtract that number from your unmet need, primarily number to secure your final unmet need. All right. So I don't know, Donna, I don't know if we have more questions or if we have time for questions. I'll leave that up to you.
I've been answering most of the questions and stuff along the way, but I'll just sort of recap them for the entire audience. One question was about the utilization of migrant farm worker housing and whether or not that should be counted in the HIC, and that answer is no. Migrant farm housing is not included as far as the homeless programs for HUD. Another question came in as far as, is the HIC and PIT the same date? And HUD encourages everybody to utilize the same date for the HIC and the PIT, but check with your local CSC to see if that's going to be the case or not. We also had a question that came in about whether or not we're recording this webinar for later view. And I'm saying right now that I've got my fingers crossed that it's recording and that it's going to be okay. We've been attempting to record the last several webinars that we've done so that we can upload them, but unfortunately there's been some problems with the mechanics around how it gets recorded and how it gets transferred so that we can upload it as a video. And be honest with you, that's above and beyond my knowledge and understanding of things, so I'm probably not explaining it very well. But we are trying to record this. Hopefully, if it does get recorded and we can do something with it, we'll actually get it put on YouTube and send out a link to it. If that doesn't work and you're interested in seeing like our actual script from today, if you contact either Yvette or myself at the emails and stuff listed here, we can send you a script that has our notes and stuff from today's presentation. And I think that does it as far as the questions for today. If you do have questions, I really encourage you to look at the great HUD guidance tools that they put out there this year. That point-in-time guidance methodology booklet and stuff really goes into some great information as far as explaining things. HUD has done a wonderful job with coming up with some surveys that can be utilized at the local level. So check with your COCs to see what you're going to be doing on that local piece. And I guess just sort of as a final note, just to remind any of you that are part of the Balance of State that Christina and Erica is going to be holding a couple of webinars specifically to how the Balance of State is going to be collecting this information sort of process-wise and how it's going to be recorded, and they'll be getting out additional information to you as far as how to register for those. And on that note, I just want to thank everybody for their participation in today's webinar. We wish you all the luck with planning your point-in-time count and housing inventory count for 2015. And take care and have a wonderful day. Bye-bye, everybody.
Bye, everybody. Thank you.